so now we are going to get a CABG, an open heart surgery patient, out of bed. Remember, with these patients, they have sternal precautions. So there are some facilities that now allow you to kind of move in the tube, where you keep your arms kind of close to you, but there are also facilities that really are strict with their sternal precautions. And we know that those sternal precautions, you can only lift your arms to about 90 degrees, okay? The patient still can wash their hair or do ADLs, lifting their shoulders up, but you can't lift beyond 90 degrees. So be careful when you're checking for range of motion, because while they might have full passive and active range of motion, we don't want to put them into that position because of those sternal precautions, okay? The other thing we want to avoid is pushing and pulling. And this is very hard for patients to not do, especially when they're getting out of bed. A lot of them might not be in the best shape, so they heavily rely on their arms rather than their abs to get out of bed. The other thing, we don't want them carrying anything heavier than 5 to 10 pounds. So usually we say no more than a gallon of milk for whenever they're lifting, okay? So getting this patient out of bed, I want to make sure I'm explaining these precautions to them. You know, I tell my patient we're going to work on getting to the edge of the bed. I'm going to have you do everything that you can on your own first, and then I'll help you if you need it. So I'm going to put this bed rail down. I'm going to say, I'm going to bring your blanket down, make sure you're all covered up underneath. Is that okay? All right, so a lot of times these patients also have something to hold on to, usually one of those fancy heart pillows. But what I'm gonna do is, to prevent her from using her arms to push or pull, I'm actually gonna give her this pillow to kind of hug. And that also helps kind of brace it against her chest to prevent pain. We also tell patients to do this if they're going to cough. It kind of helps absorb some of the force with that cough, okay? So whenever you're getting up, we don't want to use your arms. You're going to heavily rely on your legs and your abdominal muscles, okay? So we're going to get to the edge of the bed here. So what I want you to do is walk your legs over like you're bringing them off the edge of the bed. Very good, okay? If you can use those legs to kind of shuffle your hips forward, okay? You can't use your arms. What I want you to do is tuck your chin to activate your abdominal muscles, and then we're gonna go ahead and sit up into this position. Your patients might be able to do this on your own without you helping. You at least want them to try, okay? And I don't know if you noticed my body mechanics when I did help sit her up at the edge of the bed, if you wouldn't mind laying back down just right here. But I did kind of get behind her shoulders, and I didn't try to lift her, but I actually leaned my body weight back and kind of pulled her into that position. Okay, so I got into this position and leaned myself backwards so that we're right here at this position. This gets me in a good position too. If I need to block her knees, I'm right here, and I have good trunk control over her. So good job.